can I just welcome you all to this meeting of the Dundee City Health and Social Care Integration Joint Board. This is a meeting predominantly around the budget, but we'll have a couple of items included in that. So I'll hand over to Arlene. Arlene, can you first take item 1, apologies?
Yep, okay. Can I just remind everybody that the meeting has been recorded and will be placed on the websites of Dundee City Council and the Health and Social Care Partnership for public viewing. And I'll now take a roll call for the minute. Beth Hamilton.
Present.
Councillor Lynn.
I'm here.
I've had apologies from Councillor Toland. Councillor McHugh.
Present.
Donald McPherson.
Present.
Sam Riddle.
Present.
I've had apologies from Glenn Lloyd and Vicky Irons. Dave Berry.
Present, Arlene.
Christine Jones.
Present, Arlene.
David Wilson. Susie Flower.
Present, Arlene.
Sanjay Pillai. I've had apologies from Raymond Marshall. Jim McFarlane.
Morning, Arlene. I'm here.
Christina Cooper.
Present.
Liz Goss.
Present.
Martin Sloan.
Present.
I've had apologies from Emma Fletcher. David Shaw. Okay, that concludes the roll call and takes us on to item 1, which is apologies which have been noted. Item 2 is declaration of interest. Are there any declarations? No, not seeing anything. Item 3 is membership appointments. A relates to chairperson and NHS non-executive members. You're asked to note the position.
Okay, we'll take that. I see Ken, your hands are up, Ken.
Yeah, I just wanted briefly, we have some changes coming up in terms of our NHS board membership, and I really wanted to thank Donald and Sam for their contribution whilst members of this board. It's really been valuable, and I appreciate all the difficult questions that both of you have posed at different times to make sure that we're doing what we should be doing to help the people in our care, if you like. I'm only sorry that I think for the entirety of your tenure, both of you, we've had meetings online, and certainly in the near future, I would hope that we're going to be back in person. So I'm sorry that I haven't had the opportunity to maybe get to know you both a bit more on a personal level. But that's how it is. That's the pandemic and started that, and unfortunately we're still online, so never got that chance. But again, thanks very much for all you've done and your contributions whilst members, and whatever you're going to be doing next, which I'm sure will keep you just as busy. Good luck.
Thank you.
Thanks very much, Ken. Appreciate that. And yeah, I'm sorry we've never actually had the chance to physically shake hands, but
yeah, same here.
You never know, the pair of you may meet up with Ken in a different venue. That seems to be a nice wee small world we've got around. And I think, Donald, you're staying on as a lay member of one of the charitable committees within NHST side. So you never know, Ken, you might bump into him. And Sam's still a non-executive. He's just moving to another IJB. So thank you for those kind words. I'm sure they're very much appreciated by both gentlemen. Okay, any other thoughts, comments on item 3 in the membership appointments? Nope. Okay, we'll move on then. Arlene?
Okay, so that takes us on to 3B, which is the non-voting member, and you're asked to note the position for that as well.
Everybody quite happy with that? Okay, thank you. Right, we'll move on.
On to item 4, which is Dundee Integration Joint Board Proposed Budget 2024-2025, and you're asked to agree the recommendations.
Okay, so as this is the bulk of the meeting, Dave, do you want to take this? I know that Christine's going to be carrying out most of this item, but do you want to say anything to introduce?
Thanks, Beth. No, I'll kind of pass on to Christine to kind of take you through. I think most members will be kind of well versed in terms of where we are through the development sessions that we've had, and also the couple of papers that we've already taken to the IJB. So I'll let Christine kind of go through, and then we can pick up any questions after that. Thanks.
Thank you. And can I just say that as a new member to this committee, I've been personally very impressed with the communication with the IJB members on the board and the budget and the developments and the build up. So thank you for taking your time to do that for us, both yourself and Christine and the team behind you all. So Christine, if you could take us through it now, please.
Yeah, sure. Thank you. And thanks, Dave and Beth, for that. As members will be aware, and as part of under legislation, we need to bring an annual budget paper to yourselves to detail the implications of the delegated budgets from our partner authorities, partner organisations, along with the range of investment and expenditure proposals to set the balanced budget for 24-25. As members will be aware, we've had the public sector funding situation continues to be extremely challenging across the local authorities, the health boards and Scottish Government. And it's within this context that we're setting a budget, while at the same time trying to look at meeting our IJB strategic priorities and protecting our frontline services as best as possible. During the last few months, we've had a number of development sessions which members have been invited to, where we've been able to share developing and emerging information and discuss a range of options and opportunities that have been emerging and to enable us to present this balanced budget proposal. In terms of the budget settlement from our two partner organisations, NHS Tayside expects to set its budget on the 25th of April. And it's worth noting just in here that this is actually in normal timescales for NHS Tayside, so it's nothing out of the ordinary in terms of setting that budget during April. So it does mean, though, that the budget offer that we're looking at is only indicative at this stage. But what we are assuming is that that Dundee IJB will receive a flat cash settlement from NHS Tayside, plus a share of the recurring funding from 23-24 pay award. And it is noted that there is an anticipated additional funding should come through from Scottish Government via NHS Tayside in due course once the settlement of the 5 Agenda for Change and medical pay negotiations are known. So that's noted in there. So a further report will be submitted to the IJB in due course once we've received the formal offer from NHS Tayside, along with any recommendations or implications of that. So that's noted in 2.3 of the IJB report. Dundee City Council set its budget on the 29th of February, and the budget offer to the IJB is a flat cash settlement plus a share of the recurring funding to support the 23-24 pay award, and along with relevant share of national funding to support the national policies for adult social care pay and free personal care uplift. So apologies for the typo in table 1 and 4.4.4. That should actually refer to the 23-24 pay award, not 22-23. So apologies for that. But it is worth noting as well that this additional funding that's coming through via Dundee City Council is fully accounted for as increased costs that are directly associated with these uplifts. So this is not a new additional funding that we have got any flexibility in terms of how we utilise to meet our wider demands. So in section 2.2, we are proposing the IJB accepts the delegated budget offer from Dundee City Council. Section 4.90 summarises the recurring resources that will be available to the IJB of £301.2 million for 24-25, including the uplifts that we've just noted, subject to the caveats and the implications from NHS Tayside's budget offer once that's agreed. So As part of our budget setting process and part of our development sessions that we've had, we've looked at the known, the emerging and the anticipated cost pressures that the IJB is expected to face from its delegated resources. These are detailed in 4.5.1 and Appendix 1 and amount to an additional £18.6 million of cost pressures for the coming financial year. And then in Appendix 1, the net impact of the gross cost pressures and the additional funding gives us a residual funding gap of £10.7 million for the coming year. Section 4.6 gives a little more detail about the national policy to support the pay uplift for commissioned adult social care staff, which should provide an uplift from £10.90 per hour to £12 per hour for pay. This to be effective from the 1st of April. And the IJB is asked to approve this uplift alongside maintaining all other externally contracted commissioned service commitments for 2020 at 23-24 level. So that's recommended in 2.5. In terms of our reserves for the coming year, we opened our reserves at just under £24 million, of which 13.2 was categorised as committed and 10.8 is categorised as general reserves. The most recent financial report monitoring for 2024 that we shared with you in the February meeting is anticipating closing reserves for this current year of about £14.4 million, which is broken down as 4.4 million committed and 10 million of general reserves. So we should be going into 24-25 with the comfort of knowing that we've actually got reserves position that we can utilise, and that is obviously part of the budget setting process. Excuse me, the process. Just as a reminder, the IJB's reserve policy suggests that or indicates that we should be aiming to hold at least 2% of our budgeted resources as reserves. So that we'll be ideally looking to retain about £6 million of reserves as our minimum position. And Section 4.8 and Appendix 2 then goes into detail of the proposals for savings, efficiencies and initiatives that we're looking at to set part of the budget in terms of closing that £10.7 million gap. So those are all detailed quite extensively in that section. From that £10.7 million, we are looking at 4.9 million of recurring savings initiatives and 5.8 million of non-recurring, including looking at utilising some of our reserves to help us close that gap. So the board are asked to note that the budget pressures, the additional funding, the budget settlement and the proposed savings initiatives, which we're looking at to deliver the balanced budget for 24-25, alongside the integrated impact assessment that's also provided, and approve the recommendations as set out in the paper. So it was a very quick whistle-stop tour of it, but if there's any questions, comments, feedback, happy to absolutely discuss these.
Thank you, Christine. As I say, I think we've all had the chance to go through the build-up of these figures, and thank you for bringing it to this point. And I'll open it now. We'll start with Sam Riddle, please. Sam, you're on mute.
Sorry.
Okay.
Thanks, Beth and Christine. I think I asked this last year, just to clarify, on page 2, 4.3.1, the large hospital set aside, it said Tayside is not as yet provided a calculation. Is that liable to yield anything, do you think, or is that something you have in reserve, so to speak?
It's not likely to yield any kind of additional savings or opportunities or anything from that one. It continues to be something that we need to look at through sort of legislation, and NHS Tayside need to provide, but it's a strategic balance and it's almost a sort of a break-even notional strategic responsibility. But I can see Dave's got a hand up, so he may want to add in something on this particular
Dave, are
thing.
you wanting to come in on this one?
Yeah, no, thanks. And I know just when Christine's kind of covered most of it. Anyway, so you're right. It's a legal requirement for us to kind of have the large hospital set aside kind of element delegated to us. In terms of it is a kind of largely a notional figure that's being utilised just now. We are, but within the NHS side, there's a kind of work stream around unscheduled kind of optimising kind of flow and unscheduled care. And so the large hospital set aside is kind of part of that. So we're kind of hoping to kind of see some kind of progress around that sort of kind of commissioning model in terms of looking across the whole system over the next kind of couple of years around that. So you know, we are at still a sort of technical stage of that just now in terms of it's a calculation that's done, it's incorporated into our budget. But as Christian said, it won't give us any benefit because it'll really be a kind of a budget allocated and a spend allocated that matches the budget.
Okay, thanks for that clarity.
Thanks for clarity.
Okay. Ken, do you want to come in?
Yeah, I don't have any questions, to be honest. I think, as you've mentioned, we had quite an extensive budget setting process, which involved all members voting and non-voting over a period of time. So I don't have questions. Just a couple of comments about this budget, because this budget meeting comes against a backdrop of significant pressure in terms of the public finances, but locally and nationally. But despite that, you've done great work in closing that significant budget gap, 10.8. And I know that you're both acting up, Dave as Chief Officer and you as Chief Finance Officer, Christine. So well done. I just really wanted to highlight a couple of things that are in the budget. Firstly, the increase to £12 an hour for care staff. I think that's a really significant increase on top of the increases that we've had in the recent past, and not only for the staff who are already working in the sector, but I think this increase to £12 an hour, thanks to the money from the Scottish Government, makes care a more attractive prospect and will help, and indeed I believe it already is helping, to fill the shortages in terms of staffing, which makes it difficult to operate services. So I think that's really significant. Another thing that I'd like to mention is in terms of the fact that we've actually been improving services over the last year, not contracting them, is the success, if you like, of Hope Point, our 24-hour mental health face-to-face distress centre that anyone can go to suffering a mental health problem or in distress. The last report, which was a wee while ago now, there was in excess of 550 people had used that in the first 6 months. And it'll be a lot more than that now. So I think that's a really significant improvement in the services that we provide. I just wanted to point that out. So yeah, thanks for all the work you've done, and onwards and upwards. It's going to be a difficult next year, but we'll get there. Thanks.
Thanks, Ken.
Thank you, Ken. I think that's much appreciated by all. Donald, do you want to come in?
Yeah, thanks very much, Beth. And I suppose some similarity to Ken's comments. I mean, firstly, to thank both Dave and Christine. I mean, obviously, Christine's given us a quick summary this morning, but of course, we've had a number of sessions where the two of them have sort of taken us on the journey with them. And I think that's been really helpful, and I commend that process, you know, to show us how you've worked through the challenges and come up with these proposals rather than just springing it on us today. So thank you for that. Agree with Ken again. You know, there are some really good points in here, and I think the £12 an hour for care staff is really important. One of I've got, I suppose, 4 questions, and my first question was going to be on that point, where I know that we are passing that money over with the expectation that the providers will spend that uplift on staff costs only. And I suppose my first question is, well, how do we get assurance that that does in fact happen, and that it doesn't find itself going in a different direction. I think that's something that we as a board will need to keep an eye on. Secondly, one of the efficiencies that you've flagged up is around the care at home service. And I know it's something that we've spoken about at a number of meetings, looking for this efficiency through to help provide more bang for our buck. How do we get assurance that that efficiency is delivered, rather than that the people who get support from these areas get a lesser service? So how do we protect the service by making it genuine efficiencies rather than just skimping on stuff? My third point, again, we will recognise the reduction in care home placements, and we've spoken about that and understand the reasons for that. And for us, I suppose the question is, how do we assure ourselves that there aren't people left who should be in a care home who aren't, but that we're just managing the number of placements effectively? And I suppose the final point is, yeah, you know, I commend you all and I commend the team for delivering a balanced budget. I think it's important to remember that we're doing that with the assistance of around £4 million from reserves. That's what reserves are for. But when they're spent, they're spent. You can only spend reserves once. And again, it's a point that I've made before. How do we drive that transformation agenda forward? Because, you know, I can remember us speaking about it at previous times. But what are we going to do differently this time? Because, you know, as we run through reserves, it will be harder to make that transformation. So there's a bit of a bundle of questions in there, if you're able to share them out amongst yourselves. But don't let that take away from the, as I say, the really good job that you've done, firstly in producing the paper and also taking us with you on it. Thanks very much.
Yeah, thanks, Donald. I saw Jenny put her hand up.
Yeah,
so I
no,
know Jenny wants to come in
apologies. The
first.
new Teams in the camera escapes me completely, but I have got the microphone working this time. I will take the first three of those and let others take the commendation on balancing it. So in relation to the social care monitoring process, we have a fairly robust process that covers kind of qualitative, quantitative and financial aspects. So for each contract we will have an appointed contracts officer and somebody operationally who's appointed to that. And essentially over a period of years, we've developed a framework that covers those items, Donald. So that's the kind of thing that we would get in a return and seek assurance around in relation to both the payment and the other aspect in terms of efficiency. We are quite robust in monitoring the actual activity. The efficiency bit, I just wanted to talk to a bit. So as you'll know, we brought a couple of papers relating to how we deploy staff on shifts and how we use the downtime in relation to that. We've discovered in relation to that people make better use of that in some providers than others. So as we put the new contracts in place, we're setting a kind of target against what we would expect to see in downtime and monitoring that that's used for something. So this isn't a matter of cutting the care that people receive, it's just supporting providers about how they deploy staff on shifts and use that capacity better. So hopefully that provides some reassurance in relation to that. Care home placements, we don't actively seek to limit. So there isn't a process that says, you know, we've had 5 placements this week, sorry, you can't have any more. If you're assessed as requiring it, then there's a process of being placed that. The reduction in care home placements happens organically as we improve our access to care at home. So people tend not to want to be placed in a care home. And if we can get in quickly and act preventatively enough, it prevents it. So we haven't actively managed that down. We've actively sought to boost other options that are available to people.
And the interface that is particularly tricky for people is if you disrupt care through something like a hospital placement. You know, that being out your own house can make it difficult to go back. So things like the assessment at home service that can wrap around and do that assessment at home help mitigate that. Does that answer your questions?
Yeah, no, thanks very much, Jenny. That's helpful. And I suppose the point in the back of it is to continue to give the board assurance through the reports that you bring during the year around these points, so that we can see
absolutely
for ourselves. That would be helpful. Thanks. And
Thank you,
then
Donald and Jenny. Dave, do you want to come in, and then Christine?
Yeah, so I was just to pick up on that, on Donald's final point there, about the transformation side of things, and absolutely agree. And I think the key thing for us is we can't afford not to kind of push that on over the next 12 months, because you're right, once the reserves are gone, they're gone. What I'd much rather do is invest those reserves in transformation rather than use them to offset a kind of budget deficit position. So we will escalate that over the course of this year, so that when we're in this time next year, and when we're looking at a budget, it will not be so heavily dependent on a kind of range of non-recurring savings, including that kind of use of reserves. Because you're right, we'll be sitting here next year with a depleted reserve, and having a potentially different conversation around that. So that's the assurances I can give back to the board on that.
Okay, Christine, do you want to come in on that point?
Yeah, it's partly just to reiterate the stuff that Dave's just said, but it was also to go back to Donald's first point about the assurance in terms of making sure that providers are only using the uplift funding for the workforce. So as part of the contract commissioning offer that is available, there is letters drafted ready to go out this afternoon to our providers, or as soon as possible after this afternoon, on the assumption that the budget is agreed by the IJB. So in this letter does require our providers to acknowledge that the uplift funding will be used for workforce only in line with the national policy, and they need to return a signed declaration as part of that process before they actually start to receive the uplift. So there's that part of the first stage of the process. Then obviously the contract monitoring will continue to monitor that as well.
Okay, thank you, Christine. Okay, we'll move on. Dorothy, do you want to come in now?
I'm not responding really to Donald's questions and comments, but maybe Jim or Suzanne, who've got their hand up, would want to do that before I make any comments I want to make.
Suzanne, do you want to come in?
Thank you. It was really just which is at the forefront of everybody's head at the moment around Agenda for Change non-pay award, and just wondering, has there been consideration in relation to that and the reduction of the working week and the impact that that potentially is going to have on services? Just thought I better mention that and think about, have we thought about it?
Okay, thank you. Jenny, would you be able to answer that one?
I would have a bash, but I think that one might be better left with Dave.
Right, okay, Dave.
Yeah, thanks for that. And Susie, you're right to kind of flag that one up. It is something that's kind of just emerged kind of relatively recently in terms of a kind of a decision that's been made. In terms of the impact on the budget, and the budget that we're presenting to you today, there is no impact because we've been told it's going to be fully funded by Scottish Government. So any of the kind of financial implications of that, we've been advised will be covered. So when the pay elements of 24-20, well, I suppose it's separate because 23-24, there will be a kind of funding allocation provided through health boards that will kind of filter through. In terms of implementation of the changes, the kind of non-pay elements, these are being kind of worked through just now through NHS Tayside, and say the implications of that will kind of become known to us kind of over the coming weeks around that. But yeah, so it should be financially neutral for this budget, Susie. So thanks for that.
Thank you.
Thank you, Dave. Thanks, Susanna. Jim, do you want to come in?
Yeah, thanks, and thanks, Dorothy, for giving way there, because I think it is an important point. I mean, I welcome, you know, nobody's going to oppose the idea of raising that wage to £12 an hour, but I still think, you know, as a board and as a wider society, that still grossly undervalues the work that those people are providing, you know, and the skills and everything else that's needed out there. I think the other issue is it's not just about pay. It's about the wider terms and conditions of that workforce in particular are still, and I get there's that work, the balance around when the demand is at different times of the day and stuff like that, but there is issues around, you know, some people still having, say, 10-hour, 12-hour, 16-hour contracts who are regularly working more than 30 hours a week. So the idea of being able to plan and that work-life balance stuff, you know, we haven't got that right yet. And this idea of, you know, again, I welcome the assurances around, you know, that we're checking that people are, the providers are using that money that way. But, you know, we are still coming across, certainly as the trade unions, we're still coming across, you know, you know, and I'm not saying it's totally widespread, but, you know, I brought it up and hopefully it has been dealt with elsewhere, but there are still providers who are charging staff for their uniforms. There are still providers, or at least one, who aren't paying staff for either induction or training, or if they're paying it, they're only because if they stay for 3 months and then they'll pay it. And again, that just should not be happening in this day and age with any you know, social care provider. So, you know, that's still a kind of a real concern there about how we transform that workforce, you know, and make it much more attractive around that. And you know, what I'd want to see a bit more around is how do we marry in the fair work agenda that's led from the Scottish Government, which, you know, kind of lays down some really basic stuff there that isn't always being provided. So although we're getting a signed assurance from providers, I would also like to see, like, you know, what are we doing to follow that up, in particular asking, say, either the trade unions or the workers themselves on how that's implemented and measured and stuff like that, and not just relying on the providers themselves to sign something off to say, yes, we are doing that, because some of that stuff I've just talked about, we've been talking about for years and years, and some of these providers have said, no, we don't do that anymore, and people are coming to us and evidencing that they still are. You know, so I still think we've got a way to go.
Thanks, Jim. I think your points are well made. Jenny, you put your hand up first, and then I'll hand over to
come
Dave.
back very quickly, Jim.
Yeah.
Probably if there are specific instances like that, it'd be helpful to know where they are, so as we can follow that up. I just wanted to make the point that although £12 an hour is a kind of floor for the pay for staff, an awful lot of our providers actually pay significantly more than that. So it's a floor rather than a ceiling. But yeah, your points are well made, Jim. And if there are specific concerns, happy to look into those further.
Thanks, Jenny, for taking that on board. Dave, do you want to come in?
Yeah, no, thanks, and thanks as well, Jim, for your comments. I think, no, I don't think anybody's going to disagree with them in terms of kind of where we are. I mean, we're trying to kind of do what we can within the financial resources we've got within there. So, you know, the changes that we've already made to the kind of care at home contract. You know, we just talked about the efficiency element of that, but we've kind of given providers more flexibility within that contract itself to kind of to enable them to kind of put in some of these elements of fair work. There are, as you kind of says, sort of national kind of work streams underway, so the kind of fair work side of things would be involved in that from a national perspective, and also development of ethical commissioning, which has kind of fair work at the heart of that as well. So there is work kind of being done around it. At the end of the day, it comes back to the resource and what's available for implementation on that, because we've only been able to implement the £12 an hour because of the significant additional investment that's come through from government, and anything else is likely to fall into that category as well. But no, don't disagree at all with anything you said, Jim.
Thank you, Dave. Dorothy, do you want to come back in?
Yes. Well, first of all, can I just say that was a useful intervention, Jim, and it might be, I don't know how this works, but I mean, could the IJB maybe have a report on the sort of stresses and strains of care at home contracts, and, you know, where we are, what the position is what the issues are, what the concerns are at some stage in the not too distant future. I don't know if that's a sort of proper agenda item for us, but I think it would be interesting and useful for us as board members to get an up-to-date, you know, what's actually happening out there. Anyway, the comments I wanted to make were, first of all, to agree with Donald and Ken. I found the development sessions in advance of the budget very, very useful. And it's just helped, you know, to make this session today much easier, because we've had an opportunity to explore, you know, lots of issues in advance. So I've really appreciated that, Dave and Christine. That's been really helpful. I also want to say how much I appreciate the comprehensive integrated impact assessment which accompanies the report today. Excellent work. I don't know if that's you, Catherine. Is Catherine here? But you know, it's one of my things, IIAs, and I'm so pleased to see this significant piece of work attached to this report. So it just assures me that real thought has gone into what are the implications of this budget? You know, who is it going to affect? How is it going to affect them? That work's been well done, so thank you very much. And the last point I wanted to make was, as Donald said, we've used some of our reserves, and we're now back down to what the sort of 2% prudent standard. And as Donald said, once they're spent, they're spent. So the transformational change programme is really, really important now, isn't it? And again, I would like to see, if we can, some progress reports at regular intervals on where we are with the transformational change programme. Because if we're down to our 2%, what we're going to do next year if we find ourselves in the same position, you know, and there's no indication really that things are going to be easier next year, quite the reverse. So good work, everybody involved in preparing us for this budget session today. And if we could get an update on where we are in terms of care at home contracts, and regular updates, hopefully over the next year, on the transformational change programme. Thank you.
Thank you, Dorothy. Good points, well made. Dave, do you want to come in?
Yeah, no, thanks, Dorothy. Kind of really helpful comments there. So, in terms of the sort of overview of the sort of care at home side of things, I think we'll take that away and consider what might be something valuable for the IJB, and possibly in a sort of wider social care commission context as well. So not just about the kind of care at home challenges. So we'll kind of maybe take that away and kind of have a discussion as a management team, kind of taking into consideration your comments and what you would kind of like to see within that. So so we'll kind of make that commitment to bring something back on that. I mean, we will shortly be moving into the new contracts for the care at home service. I think Jenny mentioned that earlier. So so it might be kind of timely that we pull that together at the same time on that as well. So just one point I was also going to just make in terms of reserves. So we have quite rightly kind of talked about the kind of the 2%, and that's the desired level that we would have. But just to recognise that, you know, it's not a legal thing, it's a kind of guidance, it's what we possibly should do. So I know that probably by the time the rest of the IJBs set their budget and the country set the budgets, there'll probably be around about half the IJBs won't have any reserves at all come 1st of April. So, you know, we are still in that position where if we need to, we will still have £6 million of unallocated reserves that we can, as a board or you as a board, can decide what you want to do with it at the end of the day. So so it is, we need to kind of shift, we need to kind of stop that reliance on reserves. But it's not the end of the world if we have to dip into reserves again at some point in time. But as I said, I'd rather we invested them the way we want to invest them rather than to react to kind of cost pressures instead. So that'll certainly be the approach.
Okay, thank you. Liz, do you want to come in?
Yeah, it was just in relation to transformation of services, which everyone agrees is really, really important. And the one plea I would make is use the expertise and knowledge of people that use services, because they will know so much about how that service operates, and not just one service, but maybe multiple services and how they interact with each other. I think there's lots of expertise out there, and I think provide lots of really helpful feedback. So please make sure you involve the users. As somebody who used to work within healthcare for quite a long time, and thought I knew it relatively well, I know so much more now, now that I'm actually in the seat of healthcare, than I did when I worked within the system. And some changes can be relatively small in terms of bringing about change, but might make a massive impact in terms of efficiencies and just things working more smoothly. So yeah, that would be my plea. Please involve carers and users of services in transformation, because they'll provide a lot of information and help to you. You've always got to take them with you, of course, as well, in terms of changes.
Yeah, thank you, Liz. Dorothy, do you want to come in again?
Yes, thank you for raising that, Liz. Another thing that's really dear to my heart is engagement with our service users, and particularly older people. And I think I raised at the last IJB that there used to be a strategic frailty group, which used to meet on a regular basis, which included service users. And I take Liz's point, it's really important, to speak to the people that we serve about the service that we provide for them. And I hope that going forward this year, we can kind of beef up our engagement, with service users, so we get a real idea of what they think about what's being provided to them. I think that's really, really important.
Thank you, Liz. Jenny, do you want to come in? And then Catherine, I see you've come on camera. So we'll start with Jenny.
I'm actually hoping Angie Smith might come in this, because I know that she's been meeting with Christina Cooper around the remobilisation of this group, and Angie's actually on the call.
Angie, would you like to come on and give us an update?
Sorry to put you on the spot, Angie.
Thanks, Jenny. Thanks, Beth. Yeah, Chris and I are really keen to get the strategic planning group back up and running, but we want to make sure that things are a little bit different than they were before. So from my experience coming into that group, it was very much about us telling everybody what we were already doing, rather than the wider stakeholders directing how strategy was developed. So we very much want to change that, linking in with the local planning partnerships, getting out as widely as we can. So there's a big piece of work that will be happening around that, and I don't know if Christina wants to come in on any of her thoughts on that. But we also want to do some wider stakeholder work around the Lochee multidisciplinary hub that we're developing, because again, we want to make sure that that's maximising what is going to work for the local community. So there will be quite a big exercise this year on both of those elements.
Okay, thank you. Christina, you've come on. Would you like to come in?
Yeah, Beth, just to, it's a valid point from Dorothy, and what Angie has said, I would actually echo that. It's about looking at how to do it differently, and it being driven by the voice of the community and the voice of experience, Dorothy. So we are in the very early process of getting that started, and we will be involving stakeholders. And there is a wealth of, user involvement happening within the city. We've got a new community of practice, as well as networks and forums that links in with our locality planning forums as well, Dorothy. So that'll all be linked in, but we're at the very early stages. So I hope that gives you some assurance that we're working in the background, and we will be involving other stakeholders at the right time to help us process and move that forward.
Thank you. Thank you.
Thank you. Liz, your hand's still up. Is that a legacy, or do you want to come back in? That's okay. Okay, that's great. Okay, thank you very much. I think that was a good, healthy discussion. And I think everybody has acknowledged the value we've had as a board of working with our finance colleagues as we've built up the budget. I don't think we should not know the impact assessment, Dorothy. I'm glad you mentioned it, because I was hoping to mention it and I'd forgotten at the beginning to say how impressed I was with the length and the detail in that impact assessment. So Catherine, you've done very well, and if you don't mind, could I share that with some colleagues in other areas as an exemplar? The other thing I was going to just say is I think Jenny reminded us in her usual style about what goes on behind this as well. I think we have to acknowledge and thank all the staff that are working hard within the financial constraints across the partnership. And that's both health and social care staff, whether they're directly employed or whether they're commission services. I think we want to acknowledge the work that they've done and helping us to produce the successful meeting that we've had today and the work that's gone into the budget. So I'd like to make sure that everybody is acknowledged. Okay, so we're going on to the recommendations. Now, Arlene, is it myself that takes everybody through the recommendations, or do you do that?
Nope, you can do that, Chair.
Okay, so there are a number of recommendations and I will take them each in turn, bearing in mind the importance of each recommendation being agreed. So the first recommendation notes the implications of the proposed delegated budget to Dundee Integration Joint Board from Dundee City Council and indicative delegated budget from Tayside NHS Board from 24-25 as set out in sections 4.2 and 4.4 of this report. Is everybody happy? Anybody want to complain? No. 2.2, accepts the delegated budget proposed by Dundee City Council as set out in section 4.4 and table 3 within this report. Okay. Instructs the Chief Finance Officer to report back to the IJB following receipt of formal notification from Tayside NHS Board of the budget offer with associated recommendations, including any implications of the finalisation of lead partner budgets on the IJB's net budget position. Okay. Notes the range of estimated cost pressures and funding uplifts anticipated to impact on the IJB's 24-25 delegated budget as in Appendix 1. Okay. Approves an uplift to staff pay element of adult social care providers' contract value to enable the increased hourly wage payment to staff providing direct care with effect from April 2024, with all other externally contracted service payments remaining at 23-24 levels as detailed in 4.6.2 of the report. Approves the budget savings and financial support from reserves as outlined in Appendix 2 to this report. And finally, remits to the Chief Officer to issue directions as set out in Section 8 of this report. Okay, thank you very much, colleagues. That's us agreed the budget for the next year, 24-25. And as we've said, thank you to everybody that's been involved in this piece of work and what's going on behind the scenes to make it all happen. Okay, thank you. We can move on then to the next item in the agenda. Would you like to mention that, Arlene?
Yeah, that takes us on to item 5, which is meetings of the Integration Joint Board attendances. It's submitted for information and record purposes.
Okay, thank you. If anybody has any questions or amendments they require, please contact Arlene. Is it yourself that they would contact?
Yeah, that's correct. Thanks.
Okay, thank you for that. Okay, anybody get anything they want to highlight at this moment? Nope. Okay, thank you. And Arlene, I think it's the date of the next meeting, the next item. So I just wanted to check. Diane, is this your last meeting? I know she's hiding in the back.
I thought I'd got away with it.
No, you never thought I'd
I decided I would just be very, very quiet and stay completely off screen and just pretend I wasn't here. But yes, this is my last meeting, Chair. Thank you very much.
I personally just wanted to acknowledge that Diane's joining me in the world of retirement. You never know what life brings you after you retire, Diane.
I can promise you it won't be the NHS board.
I just want to just quickly mention that I've known Diane for a number of years. I've worked with her in various guises, and I want to just thank her and my appreciation of the work that she's dedicated through her career to Dundee. She's a Dundee lass and she's very proud of it, and she's committed herself to it for a number of years. So from myself, I'd like to thank you. I have to say, Diane, I've had lots of wee messages in the background as well saying, "Mind, remember it's Diane's last meeting." And I thought, yep, she's definitely not getting away with it, and people are thinking of you. And I'm going to hand you over to Ken, because I know he's very keen to have the last words and really express on behalf of the IJB and the partnership, our gratitude to you. So Ken, take it away. You're very eloquent. Go for it.
I don't know that I'm very eloquent, but I certainly do like having the last word. So thanks for that. You know, Diane,
it's not going to happen very often, Ken, but on this occasion, on you go.
With all the pressure of this being the budget meeting, I'd actually forgotten it was your last meeting too. I think I attempted to pay tribute to you at the last meeting and then was told, no, it's not Diane's last meeting. But today definitely is. So I've worked with you for God knows how long now, many years, because I've been involved with health and social care as a councillor, I think almost since I was elected. So I've known you a really frighteningly long time. I think we were both relatively young when I first met. Well, we're still relatively young, but you know what I mean. So it's been an absolute pleasure working with you, and thanks for all you've done for Dundee and the people who we provide services for, who rely on them so much. And hope you have a very happy retirement. I'm sure you'll find plenty of things to do. Thanks, Diane.
Thank you very much, Ken. Am I allowed to say something, Beth?
Of course, I was going to say, if you want to say something, please do. If you don't want to and want to run away, that's equally well. But I'd like you, if you want to say something, be very welcome.
As you know, I'm known for trying to say something. I'm also equally known for not saying things when it gets a bit embarrassing. So I agree. Just if people don't know, I've worked for Dundee City Council for 38 years. Started off pretty lowly and ended up kind of where we've ended up. So it's been a long kind of situation, and I think I've seen huge changes over the years in terms of just where we started as social work and where we are in terms of health and social care integration. And I think we do a great job in terms of the services we provide against what are really tough and challenging situations in terms of both finances, but also just trying to work across two partnerships. But I think right at the very beginning, we really saw the benefits of bringing a lot of this together. And I know that we're talking about NCSs, although I'm probably don't know that it's going to happen quite the way they intended. But if it does, great. And if it doesn't, then it's really just about continuing to make the best of what we can in terms of bringing the services together, because it absolutely is the right thing to do. So loved career, loved working. I've said lots and lots of times, for every reason to go, I can think of two to stay, but it's my time to go and let others come in and take the services forward with new energy and being quite a bit younger than me. So absolutely time to go, but it's been a real pleasure. And I'm kind of sad I didn't end this meeting as a member of the committee rather than an officer of the committee, but that was just the right thing to do as well, to make sure the Chief Social Work Officer role was in place and sorted before it went. So thank you for your kind words and good luck for the future. I think I'll leave it at that.
Well, thank you. Ken, you never got the last words, Diane did. Which is quite right. And Diane, can I just say as a PS, you were never short of energy at any point, and I don't think you've lost your energy. So you'll just be using it in a very different way. So good luck. Okay, thank you, everybody. Arlene, do you want to take us through the date of the next meeting?
Yep, will do. The date of the next meeting is Wednesday, the 17th of April at 10 o'clock, and it will be held remotely.
Okay, thank you. That just leaves me to thank everybody for your attendance today and for the work that everybody's put into the meeting being successful. So thank you all, and have a rest of your day be a good one. Thanks very much. Bye-bye.